We want to check in with Dr. Mitch Schulman, who, of course, is a regular here on CJAD. You can join him every morning at around 7:50, 7:55 on the morning show. But, Mitch, I want to get to a story that came out actually today. Quebec's Ministry of Health announcing that it is recommending an additional dose of COVID vaccine for people at risk. So can you break this down for us? Let's first of all go through who are the people at risk and what should you be considering doing and how and where?
So I don't want to get involved in the whole vaccine debate.
Great idea.
If you don't want to get vaccinated, that's up to you. But for those of us who are interested in protecting ourselves and our loved ones, the Quebec government is just basically following the National Advisory Committee on Immunization recommendations. But they had to prove that it applied to the Quebec population. That's the only difference. So if you're immunocompromised, dialysis, or have a chronic medical problem, if you're over the age of 60, which I take offense at, but they say over the age of 60, your immune system isn't what it should be. If you're living in a long-term care facility or visiting on a regular basis a long-term care facility or working with people in a facility like that or a healthcare worker, if you're pregnant or planning to be pregnant during this whole COVID season, which we're anticipating into the fall and into the winter, these are all the people that we're recommending get vaccinated. So if you have chronic illness, all these things. So nothing new, nothing different, nothing special, nothing out of the ordinary. They're reminding us that the rapid test kits aren't available in your pharmacy unless you're vulnerable, but they are available wherever the centers are that you would get the vaccine. You'll probably be booking it the exact same way as we have in the past. Interesting study that indicates that if you get vaccinated, you may want to get vaccinated in the same arm you've always been vaccinated in. In other words, most of us, when we go to the vaccine center, they say, which is your dominant arm? Many of us, it's our right. And so they automatically vaccinate you in the other arm. Most of us are left. So that if we have soreness or something, it doesn't really affect our day-to-day activities. Turns out a lovely study showed that the immune response might be stronger if you get it in the same arm that you got it in last time. And the current recommendation is wait 6 months since your last vaccine or since you had the last illness to get the maximum boost from this reconstituted. And that's what it'll be. The mRNA vaccine we'll be seeing as part of this campaign is being reviewed by Health Canada as we speak. Well, actually, probably not at this moment. But and they're looking into a new formulation that more closely matches the Omicron lineages that we're seeing right now.
Do we have a date on this? You said they're looking at introducing these, but we heard yesterday the story that, you know what, this timeline that we have of viruses like the flu virus, for example, reoccurring in the fall, maybe not necessarily the case for COVID, right? It seems to be active now. It could be much more active before we even get to the fall.
Without question. The problem is, though, the government isn't planning to roll out this vaccine campaign until September, October. I think they're trying to parallel their flu immunization campaign at the same time, which is a shame, but it's the government. Okay. We can't change what they're doing. We have to wait till Health Canada approves the new formulation of the mRNA vaccines in any case, and we haven't heard when that should happen. And then once they've approved it, the manufacturer then has to get it into your local clinic, vaccine facility, wherever it is. So even if they approved it tomorrow, there would be at least a month-long delay until it gets out into where you and I could get our vaccine when we wanted it. So this timeline is not unrealistic. Unfortunate, yes, but not unrealistic. Most of what we're seeing now, the activity now, the variants that we're seeing now and the variants that you may have heard of, the BA2.86 that we've seen in Michigan and in Denmark and in London, it's a variant of interest rather than of concern. We'll have to wait and see where it develops at, whereas the EG 5.1 that we're seeing right now is getting more people sick. There's not a shift that goes by that I don't see someone who's there with COVID, at least one or two, but it doesn't seem to be as sick. In other words, people aren't getting as sick, knock on wood, with it as we saw with Omicron and all those other things. I suspect because most of us have some degree of residual immunity, either from vaccination or from having had the disease. And so we are expecting to see more of the disease as the weather gets cooler, as we move indoors, as the kids come back to school or people get back from vacation, especially after Labor Day and all of that. But the question is, how bad will it be? my fingers crossed it won't be as bad as it has been in the past.
One last thing before I let you go. This idea, and we mentioned this yesterday, this was again on a recent study, I think. If you've had COVID, even if you've had it once or even twice, that doesn't buy you any immunity anymore, right? Don't consider not getting a vaccine because you have.
Yeah, see, the thing is, you definitely have more immunity if you've had Omicron, which is what almost everyone has had if they've had COVID within about the last, we'll say since January or March of this year. So most people, if they've been sick with COVID since, we'll say that period of time this year, have probably had Omicron, and Omicron really seems to have boosted people's immunity, especially if they have what we call hybrid immunity. You have the full vaccine series and you got this, you may not, knock on wood, have gotten all that sick, but it really boosted your immunity. But as far as we can tell, that immunity only really lasts about 6 months. And that's why the National Advisory Committee on Immunization's recommendations are 6 months after your last dose or 6 months after you last had COVID. That is when they recommend that you get boosted.
Okay. And by the way, if you had it before Omicron, so that goes only back a year and a half, 2 years ago, you should consider obviously getting it as well, getting the vaccine.
Yep, without question.
All right.